Do you sometimes feel like tiny things set you off, like someone cutting in line, and suddenly you're yelling or clenching your fists? Or maybe your heart races and your hands shake, even when there's no real danger. Well, you're not alone. Some people struggle with controlling their anger, and it can go beyond normal frustration. That's where intermittent explosive disorder, or IED, comes in. Imagine getting so angry over a small problem, like someone taking your parking spot, that you end up breaking something, screaming at them, or even hitting something. These intense outbursts happen suddenly, aren't planned, and are way out of proportion to the situation. It's not just being annoyed. It's like an emotional storm that erupts fast and passes quickly. Afterward, many feel regret or shame. The key thing, these reactions happen again and again, and they hurt relationships, jobs, or even lead to legal trouble. So why does someone lose control like this? It's not just bad behavior. Think about your brain like a car. The gas pedal is your emotion, like anger, and the brake is your brain's ability to calm down. In IED, the brake doesn't work well. Some people have changes in brain chemicals like serotonin, which helps control mood. Low serotonin might weaken the brake. Also, if someone grew up in a home where yelling or violence was normal, their brain might have learned that anger is the way to respond. It's like copying how your family dealt with stress. Other factors, head injuries, especially during childhood, can affect brain areas that control impulses. And genetics, yes, if a close family member has IED or another mental health issue, the risk goes up. But it's not just one cause. It's usually a mix: your brain chemistry, life experiences, and how you learn to handle anger. How do you know if it's more than just a bad temper? Here's a real-life example. Jake gets angry when his Wi-Fi drops during a game. Most people sigh or complain. But Jake throws his phone, yells at his sister, who did nothing and kicks the wall, then feels terrible minutes later. These angry outbursts happen at least 3 times in a year, and each one is intense. Physical aggression, like hitting, breaking things, or verbal attacks, screaming threats without thinking. Before an outburst, you might feel fired up, headache, tingling, heart racing, or feeling tense. The anger builds fast and explodes quickly, usually under 30 minutes. Important, the reaction is way too strong for the actual situation. Afterward, people often feel drained, guilty, or embarrassed. It's not premeditated, it's impulsive. And it causes real problems: fights at work, broken relationships, or even police calls. There's no blood test for IED. Doctors use conversations, not machines. A mental health expert will ask things like, how often do you have intense anger attacks? What happens during them? They want real examples, like the Wi-Fi story above. To diagnose IED, outbursts must happen repeatedly and not be caused by drugs, ADHD, bipolar disorder, or another condition. The key is pattern and impact. Treatment, totally possible. One method is CBT, cognitive behavioral therapy. Think of it as brain training. You learn to spot triggers, like stress or feeling disrespected, pause before reacting, and use calm down tricks, like deep breathing or walking away. Some people take medicines, like antidepressants or mood stabilizers, to help the brain's chemistry. Group therapy also helps. Talking with others who get it reduces shame. A success, yes. Many people learn to control their reactions and rebuild relationships. Can you stop IED before it starts? Not always, but you can reduce outbreaks. Start with self-awareness. Keep an anger journal. When did you get mad? What triggered it? How did your body feel? This helps spot patterns. Then practice safety habits, like teaching your brain a pause button. When you feel tense, breathe slowly for 60 seconds before speaking. Exercise helps too. Running or boxing lets out energy safely. Avoid triggers when possible. Maybe avoid rush hour traffic if it makes you rage. Also, sleep and cutting down on alcohol play big roles. Angry brains are tired and stressed brains. Learning emotional skills early, like kids learning to say "I'm mad, but I won't hit," can prevent IED from growing. Prevention is like a shield. Not perfect, but it blocks many hits. Science is learning more every. Recent studies found that people with IED show different brain activity in areas that handle emotion and self-control when scanned in MRI machines. This helps us understand the broken brake idea better. New apps are being tested that send calming messages when your smartwatch senses high heart rate. Like an alert, "You're stressed, try breathing now." Also, researchers are testing drugs that target specific brain chemicals linked to aggression. Another cool advance, online CBT programs make therapy easier to access. Some studies even show that omega-3 supplements might reduce aggressive behavior. It's not a cure, but it helps. Bottom line, IED is now seen not as a bad person issue, but a real medical